Great.
Okay. All right. Well, I'm going to go ahead and get started here. Thank you guys, everybody, for taking the time out this evening. We really appreciate, and I'm so excited to have Dr. Erica Scott here this evening. It's a subject that I'm super passionate about. And, when I was reading and listening to your podcast, I was just like, oh my gosh, this is going to be so exciting. I'm going to have a million questions for you. So I want everybody to write down their questions. So at the end, we will be able to do a Q&A, but during the presentation, we won't be taking any questions. Okay. So, okay, that'd be awesome.
That's fine.
Okay.
And then you'll let me know if you can't see me.
Yeah, I can see.
Okay.
Yep, I can see you perfectly. And
Okay.
I also can see your slideshow.
Wonderful. Okay, and everybody can see it. Okay. So thank you for the beautiful introduction. That was very warm and kind. So, where do I start? So I've been in the field for 40 years. That's a very long time. And I don't believe I would still be doing this work with the passion and enthusiasm I have if it wasn't for the creative arts. Because looking at art all the time is uplifting, even when it's about very painful material. And that's hard to explain unless you've witnessed it yourself. There's something about making pain, transforming it into something beautiful, and really, quite frankly, that is the goal of therapy. It sounds a little crazy to make horrific pain beautiful, but in fact, the transformation I've seen in my office, that's a fair statement to make. Their lives turn into a beautiful testament of what it is to be a whole person. And I see that Liliana is nodding her head, yes, because she's
Yes,
seen
absolutely.
it too. All right, so I have a witness. I'm not by myself here. I began in 1985. I had a master's in education, and I was at a crossroads. I was 30 at the time. And I was praying for direction. That may sound a little corny to some of you, but it's always worked for me when I was at a crossroads. And lo and behold, I was hired with no experience. I didn't even have a master's in counseling. And I had been in the art world. I'd worked as a curator of exhibits, and I'd received some grants, and I taught photography in Europe, college level. And I loved my work. I loved being in the art world, but I needed more stability. And when I was hired, I thought, okay, I'll try this for a year and then we'll see what happens. So at the end of the year, the executive director approached me and she whispered, "We just received our outcome studies and your clients have the lowest relapse rate of anyone in the hospital." Now, it was a 200-bed hospital. I really didn't even receive training. I began incorporating the arts into my groups because of an offhanded comment one of my supervisors made. "You're an artist, why don't you include art?" And I turned to her and I said, "It's the art. It's the art." And so I tried to leave the field because working in residential rehab is insane. And then I was kind of forced back into the field against my will because I love the work, but I didn't like the setting. So that's how, when you ask for guidance, that's what happens sometimes. That year, my brother, my beloved younger brother, was ill, and he'd always been the healthy one. And he was hospitalized with a brain mass. they'd seen it on a CAT scan, but anyone that talked to him could see something was wrong. He was stuttering. He couldn't walk without holding on to the furniture, even to the bathroom, from his hospital bed to the bathroom. And so I didn't know what to do. So I brought an art pad and art supplies because as children we did art together. And I had just read a book called Love, Medicine, and Miracles. I don't know if any of you are old enough to remember that book. It was one of the first alternative medicine books ever by Bernie Siegel. And in it, he spoke about working with cancer. And he would have people who had a tumor or a cancer mass of some kind draw it as a monster and shrink it, and then turn the page and shrink it smaller and smaller until on the very last page, all you put was a pencil dot or a pen dot. So I said, Tom, look, I don't know about this, but let's try it. Maybe it'll reduce your anxiety, if nothing else. So remember, I'm a neophyte therapist. I have no training. I'm trying something from a book I read because I'm freaked out that my brother is so ill. So we do it. We don't think much of it. I close out my art supplies and take them home. And I go back to the hospital the next morning. And my brother is in the lobby checking out of the hospital with no symptoms whatsoever and no brain mass. So as a person with a science background, I cannot say conclusively to you, the art did it. But I don't know what else it could have been. And whether it was the art or not, it captured my mind and my heart and my soul in such a way that I spent the next 40 years studying and researching the creative arts. So I included art in my research. It was very avant-garde in many ways. I researched women who are dissociative identity disordered, who self-mutilate. And lo and behold, my research was published by UCLA, and I won or was granted the title of honorary fellow for the International Society for the Study of Trauma and Dissociation. That's more impressive primarily because if you knew my birth circumstances. So I was born with, believe it or not, fetal alcohol effects and failure to thrive. My mother didn't know she was pregnant and continued drinking way beyond the time that was okay. Fortunately, she did stop. I published all this in a book called Believe Beyond in a chapter. It's a book published by Kate Butler. It just came out last month. It's not a story I ever thought I would go public with. But the reason I share it now is because I was failing fourth grade for the second time when my teacher said to my mother, you should get her an art teacher. So my mother hired an art teacher, and after a year to a year and a half, I was reading college level. That there's no other change in my family. I wasn't receiving tutoring. Nothing else changed. My mother didn't stop drinking. Nothing changed except art classes. So this is why I've never doubted the power of the arts to heal. Does that make sense to you? It's why when I brought it into sessions with clients, I never had a doubt that it would help people get better. So are you all with me now? Are you still?
Yeah.
Okay. So I love this quote. It's very simple, but it's so true. The hands will solve the mystery that the intellect has struggled with in vain. And that is true on so many levels. So talk therapy works. We all know that. There's plenty of research to support it. Well, why are we not adding the hands and the eyes? Because that engages more of the whole brain. So of course, talk therapy works, and adding an art component enhances the results. So I teach not just art therapy, but I also teach classic drawing exercises from college. So I went to art school, taught at art school. And so this particular technique, for example, you don't look at the paper while you're drawing. It's very, very challenging to do this process. It's very frustrating. Yet it helps people see past stereotypical assumptions of reality. Well, isn't that what therapy is all about? Because it, like Robert Fritz says, there is no dream too big to create. Where people are tripped up is not that their dream is too big, but they're not grounded in current reality. So that's true with therapy too. I believe anyone can heal, and I worked with profound victims of childhood sex trafficking and dissociative identity disorder, and I've seen people create health that is beyond explanation. Yet part of how they got well was by facing the reality of where they were today. So here's a definition. I hope you can read it. It's very simple. And the idea is that if just the imaginative action, the imagery, and the hand motions of painting, drawing, sculpting help with every aspect of mental and physical health. So I do ask that you don't take screenshots or photos. This is confidential, private information. I have a release to share it, but that doesn't cover you. If you reproduce it, then it doesn't cover you. So please do not reproduce this art. But even this painting, isn't this I mean, technically art therapy is not supposed to be beautiful. It's about portraying your inner world. It's not about skilled art, but there's something about the authenticity, the truth of these paintings that I find extremely beautiful. And just to let you know that while I try not to dwell on it, there's a lot of trauma in these slides, and something might trigger some emotions for you that are uncomfortable. And so I just ask that you take care of yourself. And if you feel overwhelmed, then please reach out to Liliana or me even afterwards, because we don't want you just to suffer by yourself. My experience is that some emotions might emerge a little bit for a little while, and then they resolve very quickly. But just remember you can take a break, you can draw or doodle, which is surprisingly helpful. You can call or text a friend, but just take care of yourself. And this is a body map by a man who had been to multiple treatments, had survived a murder attempt it cut I think it nicked an artery, multiple suicide attempts and overdoses, self-harm. And he's now has international recognition in his career. So he's doing really well. Like I said before, the aim of art is to represent art as in this context is to represent not the outward appearance of things, but their inward significance. I use not so much recently because it's pretty labor intensive, but I love mask making. So I'll show you some masks today. So someone said, can I do art at home, art therapy? Absolutely. Any kind of art is therapeutic. So if you want to use The Artist Way by Julia Cameron, that is really therapeutic. It's a combination of journal writing, and I think she encourages collage and looking at art. Even just looking at art can be therapeutic. We know just looking at art helps people with dementia find words that they had lost. So that says a lot right there. I believe our subconscious speaks in symbol and image. So anywhere, I one time, believe it or not, in a residential program here in Malibu, right on the coast, they ran out of space and put me in the basement, and there wasn't a place to sit, and I sat on the washing machine. It's still good therapy happened. So um and when I speak of the arts, I'm primarily today talking about image, but it includes all of the arts. And if you want more research than what I provide today, please read the book, Your Brain on Art. It just came out last year, written by 2 faculty members at Johns Hopkins. It covers the research on all aspects of the arts. It's very thorough. And again, I mentioned this before, good art therapy does not mean good art. In fact, I've always loved outsider art, and that's like art by people that may not have shelter, or art by people from different cultures that aren't trained, that are called primitive artists, or art from France during a period called art brut, which meant beast. Art like they called themselves the beast movement, basically. And it's very primitive, very raw, very expressive art, or even the German expressionism pre-World War II Germany. Some of that art just grabs my heart. And that's a lot of what is produced in session. So someone asked before today, I don't have an artistic bone in my body. Can I still benefit from the creative arts? Well, here's someone who flew in from the East Coast. They came right after the Woolsey fires. Our cell towers were burned down. Our city was a mess, and she found it very frustrating from the Northeast. She's used to things happening exactly when she wanted it. Nothing was happening because we were crippled from the fires. She sits down in my office and she screams, not just shouts, screams, I hate art therapy. And I started to laugh, and I said, well, you have a choice. So your money won't be refunded, and you can jump in with both feet, or you can waste your time here. But I'm hoping you'll jump in with both feet. So she started a body map the first day, and this is what you see on the left. And it's pretty typical of some, and you see the number 14. So she's reaching back to an adolescent period of time that was painful and difficult. And she woke up the next morning, and for the first time in her life, without a prompt from me whatsoever, she wrote a affirmation, gratitude list for the first time in her life, and put 30 items on it. And she didn't even know what inspired that. Then she comes into the office, and she's beginning to act out anger at me. That's not a surprise. And I said, why don't you put that on your body map? It's interesting. She's the first person I ever asked to do that. And she was surprised. She said, you want me to paint it on my body map? And I think she may have been thinking like how some therapists are afraid to ask someone if they're suicidal because it might suggest suicide to them, which we now know is not true. I think she was worried that it would exacerbate her anger, and that's a risk. That's a true valid risk. And I looked at her and I said, well, it's not going on my body map. So she painted her rage, and you can see all of her derogatory names for herself. And again, it was that very cathartic and very adolescent fury. And I was thrilled, actually, because where do we have a safe place to express our rage? So I had her stand and look at her body map, the one in the middle, and breathe it in. And then she looked at me. I'll never forget this. For the first time in my life, I feel as if I'm all here. I have insides and they're mine, and I'm not giving them away, which was amazing because with her symptoms, empty insights are very much part of the profile she was presenting. And so somehow, without any words from me, no interpretation, no feedback except breathe in this body map, she gets to the heart of where she needs to go all by herself, with art leading the way. And then the third body map, I asked her to paint how she felt afterwards, the healing, the calm, for the first time in my life, I am all here. What did that feel like? And that's the third body map. So you don't have to have talent. In fact, I joke that the only people that have trouble with art therapy are people that are professional artists. But because it's about jumping in. So all three of these masks came from one workshop training therapist. And what I love is the great diversity. Do you see, like, so I am not the kind of therapist that has a group where we're going to do this today. I say, what do you want to work on? And everybody gets to work on what is important to them. So in the same workshop, all three therapists chose totally different topics. I love this. The one on the right was a therapist who had 8 years of recovery with an eating disorder. And she approached me and she said, I've never been allowed to process my self-hate in therapy. And I feel I need to do that. She said, I think therapists are a little afraid for me to process self-hate. And so we checked safety, that she's not suicidal. I didn't think she was. And I said, fine, just let me know if you even begin to feel unsafe, let me know. Now remember, I'm not her therapist, I'm her teacher. So I basically stayed out of it. I kind of would anyway, but. So honestly, and I'm used to seeing pretty intense work, when I saw the noose around her neck and the knife in her side of her temple, I have to say I was a little bit alarmed. But she looked fine. And then when we gathered to talk at the end of the group, I looked down and she's rocking her mask like it's a baby with love. And she looks up at me and with this beaming, radiant smile, she said, my empowerment was locked inside my self-hate. I would love that for all of us. Isn't that beautiful?
Beautiful.
Yeah. So also to let you know, like, so absolutely do art at home, absolutely do, like, if you're anxious, paint your anxiety, do collages about your anxiety, and then also the polarity. What is the opposite of anxiety for you? So this was in a mask making workshop, not for clients. It was for just a mask making creative arts kind of workshop for people in town that were friends and hanging out together. And I did not expect this. Now, repressed memories is my area of expertise, but so I use this slide, number one, because it's so powerful, but the other is because when I teach other like therapists that are wanting to include the arts, just know that the arts can bring up a lot in a ways that are unexpected. And so she was fine. She was in therapy. Nothing was new. Nothing was a surprise for her. She just, someone, when they made, this was a very, very beautiful woman with like a China doll, Dresden type face. And whoever made her mask didn't handle it very skillfully. And so she decided rather than fight that reality, she went with it. And um, and I'm very impressed with what she did. And this is my first mask. I always do whatever I use with clients. It's not fair for me to ask them to do something I haven't done unless we co-create something together and it's spontaneous. But usually I've done what I'm asking my clients to do. So I had a professional mask maker make my mask, and he I don't know if you've ever had a mask made in childhood, but you put Vaseline all over your face and then plaster of Paris, and then you pull it off. It's sort of like a rebirthing process. And the mask maker put the white mask on a ledge. So I've got Vaseline in my eyes. I open my eyes and I see this profile. Now, my brother and I didn't look alike. He was much taller. He had blonde hair and brown eyes, and I had dark hair and blue eyes. I hadn't realized our profiles looked exactly the same until that minute. And I was stunned. That could have been my brother's death mask. And so, like the slide before me, I went with where the materials took me. Does that make sense? So sometimes we have an idea what we're going to do in therapy, and then sometimes the materials say, no, we're going this way. So this is a mask honoring, grieving, and celebrating my brother's life and death. And this is a mask I made right after my husband died. And processing grief and loss creates wholeness. It's hard to see that when you're inundated with grief. But if you are able to express it, however, I choose art. It's my go-to. Journal writing and art, poetry writing and art. There are many ways, and there's no bad way, except, well, destructive ways, but anything that's life affirming, yes. And so in our busy world where we all talk fast and we talk a lot and we run from this to that and that to this, and we're so busy all the time, sometimes we bypass steps that are really important for being whole. And by wholeness, I also mean physical wellness. So the creative arts therapies are not yet considered to be evidence-based, but if you read the book, Your Brain on Art, you'll see that there is a plethora of research, good research, solid research, supporting the creative arts and their power to heal. I think we've barely touched the beginning of what can be done with the arts. And if you think about it, I don't know if you've ever gone to like a folk museum or a history museum of ancient art. For many of the ancient cultures, making art was part of their spiritual sacred practice. Does that make sense? So the art objects they made were more than just art. They were symbols of their God or their higher power or their spirit. And so art, even today, tends to open up a gateway to another dimension. I believe it was, what was her name? Bolt. Well, who's the woman, the psychiatrist that had the stroke? Was it Bolt of Insight or a stroke? She had a stroke and had to develop her right brain because she literally lost her whole left brain in the stroke. And she was this very famous neurologist. And she speaks about the right brain, which is tends to access the right brain. How it is our gateway to a higher consciousness, to a higher power, to the divine. And she speaks about how having to develop her right brain helped her become a better person, which is really interesting, a kinder person. So this study, it's actually 10 studies, shows significant symptom improvement, especially for the left column: substance use, eating disorders, PTSD, dissociative disorders, suicidal ideation, and psychosomatic physical symptoms. But it's also helpful in a way that's significant for the column on the right. It's just even more dramatic for the column on the left. This one I love, and I want to mention it today because of your treatment center for cancer. But this study is out of New Zealand, the first one, number A. And it evaluated 9 symptoms of what people experience while they're being treated for cancer in a residential program. And this would be a traditional hospital versus the center. And so what was revealed is that 1 hour a week, so this is art therapy, only 1 hour a week, 1 hour. And it's not prescriptive, which is my preferred way. So the therapist didn't come in and say, we're going to deal with tiredness this week. The therapist came in and said, what would you like to work on? So it was very organic. It was very client-centered, patient-centered. And 8 out of the 9 domains tested showed significant improvement or relief. And the authors of the study say that they think it would have been all 9 domains, except there was something called the floor effect. So they had given a medication that helped one of these domains. And so that confounded the research results. But they thought if that medication hadn't been given during this research, that they would have been able to say art therapy 1 hour a week helped 9 out of 9 domains. It's pretty impressive.
Very impressive.
Yeah. And then I will show you a slide where a client came in and had extended detox symptoms. She was an addict who had to take, she says, the doctor says, she had to take opiates after a knee surgery. I think that's questionable, but she took opiates. That was her drug of choice. She had a year or 2 of sobriety and had a very difficult time staying on the protocol. Fortunately, had friends stay and lock up her meds, so she couldn't cheat. But then her detox extended past what would be expected. And the detox symptoms were a trigger for her to relapse. So I'll show you a body map where she came in and we worked almost only on her detox symptoms and resolved them. And so here's also like just some things I've observed about using the arts with clients and in groups. And it's just, I mean, it seems to help every aspect of life. And then Dr. Vanderkolk, one of the top trauma psychiatrists in the world, references positron emission tomography when he's declaring in a rather emphatic way why it's important to include a creative arts therapy for those who experience emotional and physical trauma. So we all know Freud had, I mean, I'm not over speaking. I think everyone knows Freud had an ego. He was a little bit famous for his ego. One time he said his theory that he discovered, which was the seduction theory, was equivalent to the discovery of the Nile, the river in Egypt, which is pretty extraordinary. So am I still on with you guys? Can you, Liliana, did we drop off? Okay, I'm just going to keep going until someone, I'll turn my phone back on so you can call me if I'm disconnected. Let's see, let me escape this for a minute. Okay, so I'll read the question. Thank you, Francis. I've always struggled with art and drawing. So many of us do, and even I do sometimes, because we all have bad art teachers or no art teachers. And I'm sorry to hear about your diagnosis. I recommend scribbling. Believe it or not, scribbling can be really therapeutic. And we all know, like, so when I taught Andrew Weil's fellows, the medical doctors, I thought they would be so open to art therapy because they're alternative medicine practitioners. They were not any more open than any other group. And so I had a lot of them do any drawing or painting with their non-dominant hand, because we all know we can't draw with our dominant hand. So it's not, it's again, we're back to, it's not about the quality of art. It's about moving your hands. It's about being engaged. You can also do collage. So where you cut and paste. And if you have trouble, I see someone, MS, and art can stir up PTSD and intense grief. So if you can't afford therapy, I highly recommend support therapy, but maybe create a support group of friends that you can call for when things emerge. One time I had a firefighter in my office and he was not used to crying. And our first session, tears streaming, and it was so precious. He's like, I can't stop crying. And I said, just keep painting, it'll resolve. So that is, but again, it's different for everybody. If you feel flooded, then it's time to stop. If it's too much, and it's better to stop a little bit before it's too much. So, but I highly recommend doing art at home. Just know your history, know your vulnerability. Yeah. So, and if you feel alone, I have participated in 12-step groups. I've participated in free groups myself for my own healing. One time, about the time where I became an art therapist, I had walked out of a relationship basically with the clothes on my back, and I had no money for therapy. And so I participated in support groups. It's much better than being by yourself. We are hardwired to be together. And I know it's hard if you've been hurt, but I strongly encourage you to get support one way or another. And as a mostly introvert, I call myself a shy extrovert, but I'm really more of an introvert. I have to force myself to reach out to connect to people. Yes. So, hmm. So for example, somatic therapy, you're asking about that. I overtly ask people to paint on their body, parts of their body that are in pain or stressed, or and there you saw some images of somatic symptoms like perspiration. And I ask people to then also note the parts of their body that feel good. And then we do a little bit of a attending to feeling, noting, observing the parts of the body that feel bad, and then draw the attention of the person to the parts of the body that feel good, and back and forth until some of the painful feelings are relieved. And so it won't relieve painful feelings that are telling you something is really wrong, by the way. And you don't want that. You need to have pain to tell you that you need help. Does that make sense? I think that makes sense for you. So, and you say versus movement, but I've had clients dance with their body maps. So you can incorporate movement with the painting. And I love something called trance dance that includes both. You think the healing part of the therapy is that the person is able to express themselves in a way they never could, and it's using part of the brain that they haven't used. Yes, Kimberly, I agree with that, and more. Yes, that is the heart of it. And then there's even more dimensions to what you said, but you're right on. It's using parts of the brain they've never used. It's engaging. So for example, we know from education that children, adolescents, college students learn better the more senses we involve in the education. So the more we have videos and music and projects where you build things and collaboration with other students, the more senses, sound, movement, the more we include with education, people remember it better. So the same basic principle works with art therapy. So, okay, I read someone said maybe new friends. Yep, sometimes I've had to reach out and make new friends. And so you can too. And the advantage of being involved with this center is that you have a chance of meeting some really support people or friends. I do believe, so you could, believe it or not, even start with, although it doesn't have exercise in it, it's only $15. This book that has the story of my childhood and the healing from art in it. So you could start there. And then I love The Artist Way. It addresses primarily blocks to meeting our goals, but it also has a lot of journal writing about this, our history and our childhood and our past. I'm trying to think of another book. You might find some exercise. You'll find some exercises online on my website, which is www.artspeaksoutloud.org. www.artspeaksoutloud.org. And there are some podcasts there, and I talk about different exercises there. So this is not my book. It's published by Kate Butler. I'm one of 20 or 30 authors in the book, but it has the story of my healing from my childhood. There's another chapter I wrote in one of her books boy, I blanked on the name of it. And Women Who Dream has a complete, thorough, detailed exercise of writing love letters, poetry, and art. And so that's in Kate Butler's, the publisher, her book, Women Who Dream. But in that book, I have very detailed explanations about how to go through an exercise of love letter writing. And you can use that for other things as well. So, okay, you're planning to do some art therapy courses at the center. Great. Maybe I can help with that. So, any other questions? Did I answer them well enough for today? And you're welcome to email me. Let me put my email if you have questions tomorrow or I didn't thoroughly answer your question. Please feel free to contact me. I'm an educator at heart. Okay. So that should be to everyone. And I'd love to hear from you. I offer workshops sometimes. In fact, I'm giving a body map workshop at the end of May in a home here in Malibu. We're going to have about 20 people. It's all day. It's $200 for the day, which is a very competitive price, very reasonable price. And I will bring the art supplies, but you can also bring your own as well. It'll be with a lovely group of people. So if that interests you, or you can do the same in your own home. I'm also giving a free lecture for disaster survivors at the Malibu Church and a free workshop for disaster survivors at the Malibu Church. But I do things like that all the time. So if you email me your name and email, I can put you on my mailing list so that you receive announcements about various activities that I'm up to. I lecture quite a bit around. So any thoughts, questions, feedback? Okay, I'm happy to send you a flyer. Be delighted. It has my old picture. I'm sorry I haven't updated it. But it's when I still had silver hair. Anything else? Any other questions? Please don't be shy. All right. Well, I am delighted and thank you for attending and staying till the end. And I look forward to reconnecting. Okay, bye-bye.